Welcome to our broadcast, The Path to Be Well, Knowledge and Learning Session. To all our listeners, we're so excited and happy that you've been able to join us today. Now, note that you can also subscribe on our YouTube channel or find us on weedwell.live. These sessions are focused on adding clarity regarding cannabis as a treatment option and whether or not it's right for you, and will bring clarity and help you make informed decisions with respect to improving your quality of life. Now, you may know someone that could benefit from this type of information, so please do us and them a favor by sharing this event. My name is Mark Tremblay, a founding member of Simcoe Holistic Health and Weedwell. I want to share with you how I became involved with cannabis as a medicine. As a teenager, I did sample marijuana, but quickly concluded it just wasn't for me. I will admit, I did find myself judging those who did consume marijuana, thinking that their sole motive was to get high. It wasn't until many years later that I discovered the true medical benefits of marijuana. A loved one was diagnosed with MS, and after many months of symptom manifestation resulting in sleepless nights, I witnessed firsthand how cannabis can help alleviate symptoms and improve sleep. My eyes were open and my interest further increased. As a result, Simcoe Holistic Health opened its doors in 2013. And since then, we have served nearly 6,000 patients, ranging from ages 3 to 93. I have personally witnessed countless individuals and families experience improved quality of life. Having said that, I've also observed that cannabis treatment is simply not for everyone. And for those reasons, I want to caution our listeners that cannabis treatment is not a one-size-fits-all. Determining if cannabis is an appropriate treatment requires the attention, care, and focus of your healthcare team. At Weedwell, we are committed to helping people improve their quality of life, and utilizing cannabis as a treatment option is one way to accomplish that. So joining me today is my colleague, Paul Calori. And today, the topic is how to design your own tailored treatment plan. So I'm pretty excited about that. So Paul, welcome.
Morning, Mark.
Paul, I don't know if you can hear some of the noise in the background. And I'm not sure if that's from your end, but anyway, so we'll carry on here. So Paul, I'm excited about today. Going back to earlier this week, Monday being the Be Clear Day, shall we say. For those that were listening, we talked about taking your health selfie, basically looking at yourself and where you're at today. And then in the afternoon on Monday, we looked at making sure that they make a list of their medication and understand why they're taking the medication, and that they could get this information from a doctor or a pharmacist. And then Tuesday being our Be Aware Day, the first session was cannabis is not a one-size-fits-all. And we can certainly attest to that in so many different ways and examples that we have witnessed. And then the second session on that day was really how to limit change. So if you're going to start in a treatment plan, don't make some drastic change just before or during. That this should be a gradual thing to be able to really monitor the results of treatment with cannabis and be able to adjust accordingly. So always baby steps. Don't take those drastic measures. And then Wednesday, be informed. That was yesterday. We looked at the 4 most common ways to consume cannabis. And then for me, a big topic is, dose calculations. So of course, I told them about our very own dose calculator and how important it is to really be able to get a grip on that, especially more so now where the concentrations in the oil extract seems to be all over the map. So not to dwell on those things, but why I'm saying this is a good lead now into this for those who have followed us this week to be better prepared and equipped to devise and tailor a treatment plan especially for you. So Paul, up to you.
What a lead in, Mark. And you've covered a lot of topics this week. It's nice to hear. That's excellent. And so I'll take a step back for a second, and we have a resource, roadmap, in fact, to trace your path to be well. And you can find that on weedwell.tips. And we are in the Be Informed section, just as you were discussing yesterday, Mark. And the Be Informed section, one of the things you want to come away with is a treatment plan that works for you. And so we'll word it as, what you'll see on the roadmap is, I understand my current state of health, my treatment goals, how I want to consume. Again, you talked about that yesterday. And now I've designed a treatment plan that is focused on me. And this is where it fits into kind of your journey and your path to be well. Really, Be Informed is the last part of all the prep work that is going into the treatment that you're going to perform. So you talked, be clear, be aware. That's all prep work, as is Be Informed. It's the final, we'll say the final blast of prep work to when you really get going in your treatment, you can start evaluating and whatnot. One thing that it kind of, we've talked manifestos and things over time and how they fit in is one that I thought, after trying other treatments, I'm eager to find the right solution for me. And I think this fits in to the number of consumers that we've met over the years that have kind of bounced around, we'll say the healthcare system or different healthcare providers, treatments, therapies, appointments, and whatnot, and they become frustrated. And eventually, sometimes it's the last straw, if you will, and they find us and they want to discuss cannabis as a treatment option for their chronic condition. And so I wanted to bring that up and tie that in, and maybe we'll relate it to a patient story on one of the podcasts that we did. I believe it was podcast episode number 8, and it was a patient story, and Corrine was her name. And maybe we'll preface the treatment plan insofar as relating it to Corrine and how her story relates to creating a treatment plan and sticking with it. So Mark, can you share some of that with us? You're muted, Mark.
Yeah, sure about that. Yeah, Paul, I'd be happy to. And among so many great stories and testimonies that we've heard from our clients, Corrine is certainly one of them that stands out as well. Corrine, a mother of, a few children. I don't remember the numbers exactly, irrelevant, but she had been going through some severe pain issues for a number of years. The number 7 kind of rings a bell to me. Really debilitating levels of pain, where extreme difficulty in even coping on a day-to-day basis. I'd never heard of this until the story with Corrine, but she was on what is referred to as a pain pump. So literally, that is a pump that you carry with you to manage your pain levels. So it's done, correct me if I'm wrong, but intravenously through that pump. And then she also had the ability to press a button in addition to the regulated dosing throughout the day at determined intervals. If there was a need for additional relief, that she had that ability to do that. It took me a while to wrap my head around that because I had never heard of that before. A lot of it has to do with my background, which is not medical, but it really opened my eyes and trying to imagine where Corrine was coming from. So I really applaud her for, taking the challenge of really wanting to improve her quality of life over time and really putting together a plan that would help her get there. And although we all agree that it was somewhat of an ambitious and even aggressive plan, that in 1 year from the time she started her plan, that she wanted to be off her pain pump. And, that may have seemed to many, including myself, really almost impossible task to accomplish. But you know what? It doesn't mean that it was a smooth road all the way through. There were bumps in the road. There's probably days that were very discouraging and disappointing, but she carried through to stay the course and not deviate a whole lot from the plan. And Paul, and as you know, she did accomplish her goal to be off that pain pump. So over a gradual process to reduce the amount of pain meds being injected into her body. And for me, that is an amazing, amazing story. And the point here is to say things are possible. It's really about being prepared to develop a plan and a treatment plan, and then adjust along the way. Expect some disappointments because they'll probably be there, but do stay the course. And as she did, surround yourself with those that can really support you and encourage you and cheer you on. And Kareen certainly has done that well. Over to you, Paul.
Excellent summary, Mark. And so now we should really delve into what is the treatment plan. And so over the previous weeks, we've definitely discussed CBD and THC, and that's going to form, the what you're going to take insofar as creating a treatment plan. And some people will gravitate towards just CBD, especially for daytime dosing. Some people might find therapy in THC, or maybe at night when they want to go to sleep. But these are things we've already covered and how they would fit into your treatment plan. The next part is how are you going to consume it? And we've started on this, and this will continue with these knowledge and learning sessions, whether it's ingestion, topically or on the skin, sublingually under the tongue, or if you're going to inhale it, whether it's smoking, which we don't recommend, or vaping, which we tend to direct or recommend people try. Those are the four main methods of consumption. At weedwell.com, we have an excellent article, infographic. Weedwell.com, it's a 4 ways to consume article, infographic, if you want more information on that. And so you have the what you're going to consume, THC, CBD, to how you're going to consume it. And then you need to figure out the time of day or how often. And they're not the same thing, but they're intertwined. Am I going to just dose at nighttime because I want to take THC, but I work during the day and I can't do that? Am I going to dose with CBD during the day and THC at night? Am I going to use a little bit of both because I don't have anywhere I need to be, where impairment might be an issue? And so in that you get, the number of times per day, once a day, twice a day, and then the time of day. And that kind of formulates the treatment plan. And so this exists as well on weedwell.tips. You can get a sample treatment plan. The one other thing that I would point out to our listeners and our viewers is that in previous discussions, CBD discussion in particular, we talked about medication interactions, and there is a little blurb underneath there. That is something you want to check out and make sure, we'll say you're in the clear before you start going full speed ahead with your treatment plan. But that's the core of what goes into designing your own treatment plan.
Mm-hmm.
So we'll just kind of change focus here with regards to the treatment plan. And there's a couple things that you can do, and I would say inadvertently, where you would derail a treatment plan potentially. And it's the idea that, and we've met many consumers, they're almost scared of THC. And it has to do, of course, with the euphoric or high effects of it. But we wouldn't want you to dismiss THC outright, especially if there's a condition or a symptom that you're suffering from that we know or we've seen many times has been aided or good therapeutic value with THC. And so it's all right to start a treatment plan if you're comfortable with the CBD and you want to take baby steps. We've seen that lots of times. Just don't dismiss it outright. Certainly if you're scared of it. And the other thing, and this ties in wonderfully with what you were discussing this week, is don't change too many things at once. So you've done the work to get clear about your conditions. You've done the work to really understand how cannabis may or may not work for you, and now you've done the work to get the treatment plan started. Don't change 3 or 4 things tomorrow as you begin the cannabis treatment, insofar as it's impossible to tell what the cannabis may be doing or not doing. And so, we talk about trying to keep things as still as possible, or as normal as possible for you. You may want some things to change. Don't worry about doing it all day one. It's a step-by-step process. With Corrine, it was the better part of a year. And that's okay. That was her journey. And as I pointed out when I introduced, you can hear more about that, episode 8. It's a wonderful story that she shared with us. And if you want to hear, in detail exactly what it was that she was suffering from and the length of time that it took, but she stuck to that. She had that goal in mind, and she stuck to that treatment plan to get there.
So, Paul, if you just want to have a little sip of water here. And before I forget, so Corrine's story, as Paul mentioned earlier, it's episode number 8 in our podcast. And how would you find that if you're not already connected that way? It would be podcasts.weedwell.com. So podcasts.weedwell.com. That's where you can find all of our podcasts, including the one from Corrine. And that was episode number 8.
Great. So, it's a short lesson today. I think they're very clear, concise lessons to take away. Do take time in designing that treatment plan. Use some of the other tools and discussions that we've already presented in previous podcasts, and Mark, you've pointed out where they can be found. And once you get to that point where you've developed something, that's when you blast off. All the prep work on the launch pad's been done, and be clear and be aware and be informed. As far as your roadmap is concerned, the next part is be progressing, where you actually lift off or you launch. And once you get to that point, give it a try. Kind of jump with 2 feet in. Evaluate, and we'll have other podcasts where we're going to discuss on how you evaluate, what you evaluate. We've already touched on it in terms of titration and health journaling and stuff. But once you make that choice on what's in that treatment plan for you, go for it. You've done the work. And you should be proud of that work, number one. But the only way to figure out if it's going to work is to give it a try and jump with 2 feet in.
That's right, Paul. Paul, you've touched on, and I wanted to elaborate a little bit just to put things in a perspective, or cause our listeners and our viewers to, consider those things. But when we say try to not introduce too many changes, in fact, limit them, even no changes other than adding cannabis would be the ideal. So I'll give you one example that I've shared, I believe, this week. And that is, if you've seen your doctor in the past couple of days, and your doctor's made some changes in your medication to try to hone in and find you, some relief or additional relief, this may not be a good time to introduce cannabis because there's already one or more variables, and it would be counterintuitive to try to introduce cannabis as well, because you may not know really what is working. Is it the change that the doctor recommended, or is it really the cannabis? So it just makes it difficult to really determine what is working and what is not.
That's a common situation that we see, absolutely. Because the cannabis treatment just doesn't happen on its own silo. There's other things going on as well. So between the example that you gave, Mark, with The doctor changed medications. Often we see consumers that come to us that want to substitute medications. And usually our statement is, well, first off, it has to be safe to substitute, number one. But number two, if you start substituting, meaning decreasing the medication that you want to get off of at the same time you introduce cannabis, you won't figure out what effect is for what. Those are the two most common situations that we see. It's chronic conditions that we see. They've been going on a long time. We appreciate the fact that you want to get better and you want to get better like yesterday, but just give it some time. Develop your treatment plan and evaluate it on its own merits.
Mm-hmm. So key points that stand out for me is cannabis is not a one size fits all. So what may have worked for someone that you know may not work for you. It doesn't mean it's not going to work, but it could look different, and limit your changes. And then based on a story from Corrine and other champions in this area is stay the course. Surround yourself with those that can help guide and support you and cheer you on, and you'll be positioned for success.
Great summary. Stay the course, develop your treatment plan, jump with 2 feet in, evaluate it. Wonderfully put, Mark. Thank you.
So, Paul, there's resources available to our listeners, and you've touched on one or more of them already. If you can just kind of bring those up again and let our audience know.
Yes. So, weedwell.tips is where our resources are. And, the ones we mentioned today, the roadmap is present there right near the top. As you scroll down into the Be Informed section, that's where we're at today. That's where you would find Design Your Own Treatment Plan, or at least a template for it. To kind of get your mind going and things you want to fill in, so you're able to develop a full treatment plan.
Very good, Paul. Thank you for that. Before I do my wrap up and disclosure, is there any closing remarks or comments that you would have for our listeners today?
None today, Mark. I have nothing to wrap up. I think we've done a pretty good job with that.
All right, Paul. Always a pleasure. And I'm looking forward to next week already. So, folks, so I'd like to do my wrap up, as I mentioned, and a disclosure. I'd like to remind our audience that the information sessions are intended for individuals who are generally in good health, are generally well adjusted, are functioning effectively, and are not in need of medical treatment. And that includes mental health disorders. So these information sessions do not involve the diagnosis or treatment of any medical or mental disorders, and does not prevent, cure, or treat any mental disorders or medical disease. Further, these sessions are not a substitute for therapy, counseling, psychoanalysis, medical treatment, substance abuse treatment, or the advice or services of a medical professional. It is your responsibility to seek independent guidance from medical professionals to the extent necessary. So please do speak to your healthcare provider about the appropriateness of cannabis as a treatment option. For those who have taken some steps in improving your quality of life, congratulations. Remember, your journey is your journey. And as long as you've taken some steps forward in improving the quality of your life, you should be proud of the progress that you're making. At Weedwell, we are committed to helping people improve their quality of life, and utilizing cannabis as a treatment option is one way to accomplish that. On behalf of Paul and myself and the rest of the team at Weedwell, we look forward to the next time that you join us. And until then, be well. Thank you for joining me. I'd like to take this time to share with you how I first became interested and then involved with cannabis as a medicine. My name is Mark Tremblay, a founding member of Simcoe Holistic Health, Ontario's first medical clinic dedicated to the treatment and care of those patients considering cannabis as an option. As a teenager, I did sample marijuana, and quickly concluded that it simply wasn't for me. I'll admit I did find myself judging those who did consume weed, thinking that their sole motive was strictly to get high. It wasn't until many years later that I discovered the true medical benefits of marijuana. A loved one was diagnosed with MS. After many months of symptom manifestation resulting in sleepless nights, I witnessed firsthand how cannabis can help alleviate symptoms and improve sleep. My eyes were open. My interest further increased. As a result, Simcoe Holistic Health opened its doors in 2013. Since then, our clinic has operated under 4 Health Canada regulations and served nearly 6,000 patients ranging from ages 3 to 93. I have personally witnessed countless individuals and families who experience improved quality of life. Having said that, I have also observed that cannabis treatment is simply not for everyone. As we continue to grow and expand our reach, Simcoe Holistic Health is rebranding to Weedwell. For more information, visit us at weedwell.com or follow us on our social channels. Till the next time, be well.